Hello and welcome to Pregnancy Info. Today we are going to discuss all the complications during pregnancy. Some women experience health problems during pregnancy. These complications can involve the mother's health, the fetus health, or both. Even women who were healthy before getting pregnant can experience complications. These complications make the pregnancy a high-risk pregnancy. Some common complications of pregnancy include but are not limited to the following described in the video. High blood pressure. High blood pressure, also called hypertension, occurs when arteries carrying blood from the heart to the body organs are narrowed. This causes pressures to increase in the arteries. In pregnancy, this can make it hard for blood to reach the placenta, which provides nutrients and oxygens to the fetus, reduce blood flow and slow the growth of the fetus, and place the mother at a high risk of problem called preterm labor and preeclampsia. Number 2. Gestational diabetes. Gestational diabetes occurs when a woman who didn't have diabetes before pregnancy develops the condition during pregnancy. Normally, the body digests parts of your food into a sugar called glucose. Glucose is your body's main source of energy. After digestion, the glucose moves into your blood to give your body energy to get the glucose out of the blood and into the cells of your body. Your pancreas makes a hormone called insulin. In the gestational diabetes, hormonal changes from pregnancy cause the body to either not make enough insulin or not use it normally. Instead, the glucose builds up in your blood, causing diabetes, otherwise known as high blood sugar. Number 3. Infections. Infections, including some sexually transmitted infections like STIs, may occur during pregnancy and or delivery and may lead to complications for the pregnant women. Preeclampsia. Preeclampsia is a serious medical condition that can lead to preterm delivery and death. Its cause is unknown, but also women are at an increased risk. Risk factors include first pregnancies, preeclampsia in a previous pregnancy, existing conditions, being 35 years or older, carrying 2 or more fetus, and obesity. Preterm labor. Preterm labor is labor that begins before 37 weeks of pregnancy. Any infant born before 37 weeks is at increased risk for health problems. In most cases, because organs such as the lungs and brain finish their development in the final weeks before a full-term delivery. Certain conditions increase the risk for preterm labor, including infections, developing a shortened cervix, or previous preterm birth. Depression and anxiety. Research shows that as many as 13% of U.S. women reported frequently symptoms of depression after childbirth, and that anxiety co-occurs in up to 43% of depressed and pregnant and postpartum women, making pregnancy-related depression and anxiety among the more common pregnancy complications. Pregnancy loss or miscarriage. Miscarriage is a term used to describe a pregnancy loss for natural causes before 20 weeks. Signs can include vaginal spotting or bleeding, cramping or fluid or tissue passing from the vagina. However, bleeding from the vagina doesn't always mean the miscarriage. Stillbirth. The loss of pregnancy after the 20th week of pregnancy is called a stillbirth. In approximately half of all reported cases, healthcare providers can find no cause for this loss. However, health conditions that can contribute to stillbirth include chromosomal abnormalities, placental problems, poor fetal growth, chronic health issues for the mother, and infection. Severe persistent nausea and vomiting. Although having some nausea and vomiting is normal during pregnancy, particularly in the first trimester, some women experience more severe symptoms that last into the third trimester. The cause of more severe form of this problem, known as hyperemesis gravidarum, is not known. Women with hyperemesis gravidarum experience nausea that doesn't go away, weight loss, reduced appetite, dehydration, and feeling faint. Iron deficiency anemia. Pregnant women need more iron than normal for the increased amount of blood they produce during pregnancy. Iron deficiency anemia, when the body doesn't have enough iron, is somewhat common during pregnancy and is associated with preterm birth and low birth weight. Ectopic pregnancy. A fertilized egg implanted outside of the uterus is an ectopic pregnancy. The egg generally settles in one of the fallopian tubes because of the space limitation and the lack of nutrition tissues there are, a fetus cannot properly grow. An ectopic pregnancy can cause severe pain and damage to a woman's reproductive system. Incompetent cervix. A growing baby puts continual pressure on a pregnant woman's cervix. In rare cases, the pressure becomes too much for the cervix to handle. This will cause the cervix to open before the body is ready to be born, which is called cervical insufficiency or an incompetent cervix. Placental abruption. Placental abruption occurs when the placenta completely or partially separates from the uterus before a baby is born. This separation means a fetus cannot receive proper nutrients and oxygen. A placental abruption happens most commonly in the third trimester of pregnancy. Common symptoms include vaginal bleeding, contractions, and abdominal pain. Low-lying placenta. Placenta previa is a rare pregnancy complication that occurs if the placenta attaches to the bottom part of a woman's uterine wall, partially or completely covering the uterus or the cervix. When it occurs, it usually happens during the second and third trimester. Low or excess amniotic fluid. Amniotic fluid cushions the womb to keep a fetus safe from trauma. It also helps maintain the temperature inside the womb. Having too little amniotic fluid or too much amniotic fluid interferes with some of the normal functions of the womb. Venous thrombosis. Venous thrombosis is the blood clot that normally develops in a vein in a leg. Women are susceptible to clots throughout pregnancy and delivery and partially afterwards. The body increases the blood's clotting ability during childbirth, and sometimes the enlarged uterus make it difficult for blood in the lower body to return to the heart. Clots near the surface are more common. Deep vein thrombosis is much more dangerous and far less common. Molar pregnancy. A molar pregnancy is an abnormality of the placenta. It's when an abnormal mass instead of a normal embryo forms inside the uterus after fertilization, also called gestational trophoblastic disease. Molar pregnancies are rare. Fetal alcohol syndrome. Fetal alcohol syndrome occurs when there are mental and physical defects that develop in a fetus with the mother drink alcohol during pregnancy. Alcohol crosses the placenta, and this has been linked to stunted growth and brain development. HELP syndrome. HELP syndrome is a condition characterized by liver and blood abnormalities. HELP syndrome can occur on its own or in associated with preeclampsia. And other symptoms might be nausea, gastrointestinal pain, headache, severe itching. Eclampsia. Eclampsia occurs when preeclampsia progresses and attacks the central nervous system, causing seizures. It's a very serious condition. If left untreated, it can be fatal for both mother and baby. However, with proper prenatal care, it's very rare for the more manageable preeclampsia to progress into eclampsia. So this is all the complication about pregnancy. You have to understand these problems that can happen with any pregnant women. Must share this information with other pregnant women who can understand these problems and can have a safe journey of pregnancy. And if you like our video, then must share and make your opinion through the comment section. Thank you. Take care and bye-bye.